Topic 1: Gun violence. From my perspective, the most effective solution to significantly reduce gun violence in America is through a layered plan that consists of stricter gun laws, expanded mental health services in schools, and enhanced security measures like school resource officers and metal detectors in public places. Harm 1. One major harm is easy access to firearms, specifically assault-style weapons, which significantly increase the frequency and danger of mass shootings. Stricter gun control could include universal background checks, mandatory waiting periods, safe storage enforcement, and limits on high-capacity weapons. Without these stricter gun laws, dangerous individuals can still get guns and distribute them to others. The continuation of gun violence is being fueled by the current lack of regulation on guns. Only relying on mental health care or increased security alone cannot combat the root of the issue with gun violence. Harm 2. The lack of early mental health intervention is another core piece of the rise of gun violence in schools. Many offenders of school shootings often show early signs of distress or behavioral issues long before the violent act occurs. However, schools often lack adequate counselors, psychologists, and long-term mental health programs to intervene immediately. Without the proper support systems, students that are facing mental health crises are more likely to go without treatment, which increases the risk of violent outcomes. Inherency. The current system is ineffective in preventing gun control because there is no collective national strategy. Gun laws widely vary by state. Mental health services are extremely underfunded, and security measures are not consistent. Similarly, the debate over rights versus safety has stalled any possibility of reforms, especially showing that even if communities are really looking for change, these barriers will always prevent action. Solution. A multi-layered preventative solution is necessary to combat gun violence in the U.S. Stricter gun control laws would reduce the number of firearms circulating and prevent high-risk people from obtaining these weapons. Increased mental health support in schools ensures early detection and intervention before a violent act will occur. School resource officers and metal detectors, when implemented thoughtfully, can prevent weapons from even entering school grounds without creating a prison-like environment. Arming teachers is too dangerous because it increases the likelihood of accidents or escalation during emergencies. Trained security professionals should be in charge of handling the safety. Combining stronger laws, better mental health care, and strategic security measures presents the most effective and balanced path toward dramatically reducing gun-related deaths in America. Topic 2: Free healthcare. From my perspective, the U.S. federal government should provide free health care to all citizens, as this policy will improve public health outcomes, reduce inequities, and create a more cost-effective health care system instead of the current profit-driven model. Harm 1. The first harm is the inequity in access to medical care in the United States. Millions of Americans delay or avoid treatment due to cost, leading to preventable illnesses, late diagnoses, and higher mortality rates. This disproportionately affects low-income communities, racial minorities, and rural populations. Even insured individuals often face high deductibles, co-pays, or even surprise bills. These inequities undermine public health and place an enormous burden on individuals and families. Federally funded free healthcare would eliminate financial barriers and ensure that all citizens receive timely and necessary care. Harm 2. A second harm is the inflated cost of the current healthcare system. The U.S. spends more on healthcare than any other developed nation, yet achieves poor outcomes in infant mortality, chronic disease management, and life expectancy. A system dominated by private insurers generates profit incentives that worsen affordability and access. Without a shift to government-funded care, Americans will continue facing skyrocketing costs and inconsistent quality. Inherency. Private insurers prioritize revenue, not universal coverage. Pharmaceutical pricing lacks federal regulation, which allows these companies to set extremely high prices. State healthcare policies create inconsistent access across the country. Reforms have failed to address the root problems of cost, access, and equity. Only federal action can standardize care, guarantee coverage, and regulate prices nationwide. Solution: a federal free healthcare system would provide universal coverage funded through tax revenue, similarly with systems in the UK, Canada, and other developed nations that have outperformed the US in cost efficiency and health outcomes. While some opponents worry about longer wait times or reduced innovation, evidence from other countries shows that universal care still supports strong medical research and consistent patient access. Most importantly, universal healthcare would significantly reduce racial, social, and economic disparities in access to treatment, creating a fair, healthier society. Topic 3. Safe consumption sites for drug users. From my perspective, the U.S. federal government should not establish safe consumption sites for drug users because these facilities risk normalizing illegal drug use, misusing public resources, and undermining prevention, accountability, and long-term recovery efforts. Harm 1. The first harm is the potential normalization and enabling of drug addiction. By providing government-established spaces where individuals can use these illegal substances, this sends a very contradictory message that drug use is illegal and widely recognized as dangerous, but the government would simultaneously be offering protective environments to engage in it. This risks undermining prevention campaigns, reducing the perceived consequences of drug use, and potentially encouraging continued or escalated use rather than recovery. Harm 2. The second harm is the misuse of public funds and resources. Operating safe consumption sites requires taxpayer money for staffing, medical supervision, facilities, and ongoing operational costs. These resources can instead be invested in rehabilitation programs, mental health treatment, community education, and stronger law enforcement efforts aimed at reducing drug trafficking and distribution. Funding sites that facilitate drug use raises moral concerns, particularly when communities are already struggling to afford essential healthcare, education, and housing services. Inherency. The inherent problem is that the drug crisis persists because current policies fail to prioritize treatment, prevention, and accountability. Many communities lack accessible rehabilitation centers, long-term treatment programs, and early intervention services. Safe consumption sites do not address these systematic gaps. Instead, they attempt to mitigate the symptoms of addiction rather than resolving its root causes. Solution. The most effective solution for the federal government is to invest in rehabilitation, prevention, and mental health services, rather than establishing safe consumption sites. Funding should prioritize expanding access to inpatient and outpatient treatment, improving community mental health networks, supporting early intervention programs, and strengthening efforts to stop drug trafficking. This approach reinforces accountability while providing individuals with pathways to recovery instead of enabling their drug use. By focusing on treatment and prevention rather than supervised consumption, the government can address addiction as a serious health and social issue while maintaining a clear moral and legal boundary that discourages drug use rather than encouraging it.